As we mentioned in the introduction, contact dermatitis is the most commonly occurring type of job-related skin disorder. Anything that reduces the natural integrity of your skin's surface barrier makes it more likely that you will develop dermatitis. Everyday wear and tear on the job and in your home life may degrade the surface barrier. This wear and tear may come from the dry air prevalent in heated buildings during the winter, frequent immersion of your hands in water, and frequent exposure to chemicals, soaps, detergents, and foods. As the natural barrier is broken, your skin can become increasingly vulnerable to irritating or abrasive substances that can cause contact dermatitis or eczema. Certain on-the-job tasks may involve higher risk of skin contact with irritants and sensitizers. Chemicals may contact the skin during drum handling or pail handling, when touching potentially contaminated surfaces, when dispensing liquids into vessels or other containers, and when touching potentially contaminated tools or contaminated gloves. A surface may become contaminated anytime it comes into contact with a hazardous material. Always wear appropriate gloves when handling irritants or skin-sensitizing chemicals. In the controls section of this program, we'll give you more information on proper use of gloves. Most cases of contact dermatitis are due to skin irritations called irritant contact dermatitis. In fact, 60 to 80% of cases are of this type. This condition is due to prolonged or repeated exposure to mechanical vibration and friction, physical extremes of heat, which can cause heat rash, and cold, which can cause chapping, and various types of chemicals such as acids, alkalis, solvents, irritant gases, and vapors. All of these agents can injure the tissue, cause inflammation, and progressively break down the skin's natural barrier. Lesser degrees of dermatitis are characterized by chafing, chapping, cracking, and dryness. Eczema usually has a greater degree of inflammation with redness, itching, small bumps, blisters, and oozing, which may lead to scaling. Irritant contact dermatitis results when the body absorbs chemicals. Hand irritants include water, chemicals, and harsh soaps and detergents. Initial exposure to an irritant shows up as an inflamed area at the point where the irritant actually touched the skin, but repeated exposure can lead to what are called hypersensitive reactions that may begin to occur more and more often over time. Another skin condition called allergic contact dermatitis affects as many as 20% of the people who develop dermatitis. This condition is usually brought on in an already sensitized worker by relatively small amounts of one or more substances that trigger an allergic reaction. Most often, contact dermatitis symptoms appear on the hands and forearms, but can be found anywhere on the body surface. The chances that an exposed individual will develop sensitization may depend on a number of factors. The first exposure may not cause a reaction. However, extended or repeated exposures in some people result in allergic skin reactions. Symptoms include rapid development of a rash, possible blistering, and usually itching. Symptoms vary depending on individual susceptibility and dose or amount of contact. An allergic skin reaction which occurs immediately in response to contact with a substance is known as a type 1 reaction, also called an antibody-mediated reaction. These type 1 reactions may also cause intense breathing difficulty called an acute respiratory asthmatic sensitization reaction. Some materials are called respiratory sensitizers and can affect your ability to breathe. Some of these substances, such as isocyanates and maleic anhydride, may produce rashes, shortness of breath, wheezing, chest tightness, and asthma. In some cases, the appearance of allergic symptoms are delayed after the time of contact. That is, they appear sometime after exposure. These cases are known as type 4 reactions, also known as cell-mediated hypersensitivity reactions. It may take repeated contact, sometimes over months or even years of exposure, to develop allergic contact dermatitis. Additionally, allergic contact dermatitis involves a systemic response. That means the resulting skin reaction may not occur at the actual point of contact with the substance that triggers the reaction, but may show up elsewhere on the body. As was mentioned, the underlying cause of an allergic contact dermatitis reaction may be a previous episode of irritant dermatitis or increased frequency of contact with sensitizing materials. Once a person is sensitized, symptoms usually begin within 24 to 48 hours after contact. And after a person is sensitized, even a slight exposure to the sensitizing material can cause severe dermatitis. In some cases, hand dermatitis may be the result of an allergic reaction to protective gloves, especially those made from latex rubber. In fact, latex allergy is a major cause of job-related contact dermatitis, especially among healthcare workers. Latex, a natural substance from the rubber tree, can act as a primary skin irritant, but it can also cause allergic contact dermatitis. Up to 6% of the general population and 8 to 12% of healthcare workers are sensitized to latex protein and/or rubber additives. Symptoms include irritation, redness, dry, itchy skin, hives, and asthma. As more information of the dangers of latex allergy is made available, rubber frequently becomes the primary suspect in cases of work-related dermatitis. Chemicals such as detergents and cleansers and metals such as nickel and chromium may also cause allergic contact dermatitis. Other sensitizers include formaldehyde, isocyanates, isothiazolones, epoxy resins, hardeners, azodyes, coal tar derivatives, styrene, various acrylates and methacrylates, and parabens. Cross-sensitization can occur between certain classes of chemicals, whereby in the case of acrylates, for example, sensitization to one acrylate may result in sensitization to other acrylates. Chemicals and other materials that can cause allergic contact dermatitis are not found only on the job. Some of these substances may also be found in household and recreational areas, including certain spices, pollen, poison ivy, oak, and sumac. Even some antibiotics are known sensitizers. Chromate sensitization resulting from exposure to wet cement has long been known to cause allergic contact dermatitis for construction workers. In most cases, gloves can prevent reactions. In certain situations, however, they can make the condition worse. The most common symptoms are dry, red, itching skin or cracking of the skin surface, as well as swelling. Pre-existing allergies and irritations resulting from contact with substances outside of work can also become inflamed in the workplace, resulting in a work-related illness. Some individuals whose allergic reactions and symptoms cannot be blamed on a specific substance may be genetically predisposed to dermatitis. This condition is known as atopic dermatitis. These people are likely to have a personal or family history of sinus allergies, hay fever, and asthma, and may be extremely sensitive to many common irritants. In this section, you learn to identify hazards that may put you at risk of developing dermatitis and the symptoms of dermatitis. In the next section, we'll describe the controls, the practices, procedures, and equipment that you can use on the job to help protect yourself from the irritants and skin sensitizers that can cause dermatitis.